facial elalim. Elalim? No. That's interesting. Anyways, nose and paranasal sinuses. Now the objective of, yeah, Juman, thank you very much, Juman. Now I can see your answer on the chat. I wanted you to talk to us. I wanted to ask something general, not specific about something, but in generally. All right. The objective of this talk would be that at the end you should be able to describe the structure of the nasal cavity and paranasal sinuses, and relate the structure, functions, and clinical correlates of the nasal cavity and paranasal sinuses. And you also need to describe the blood supply, venous drainage, and innervation, and what was the clinical importance of learning these different aspects of nasal cavity and paranasal sinuses. And also I will want you to just relate the development with congenital anomalies that can happen if there is a failure of the normal development. Okay? Alright, now what we see here today, we will start with the external nose first and look at some of the features of the external nose. Then we will look at the cavity, the nasal cavity inside, and the features of the nasal cavity. Now we have a dorsum of the nose. Remember that yesterday lecture we talked about different regions. So we have, this is the dorsum of the nose, this is the root of the nose, and this is the apex of the nose. Okay, while these two openings are the nares, are the nostrils. As they are opening outside, we call them external nostrils. That makes sense? Okay, so these are the features that you see. Now, interestingly, you see that this is the ventral surface of the face, but this is the dorsum of the nose. Remember that when you were looking at the tongue, when you stick your tongue out, on which surface of the tongue you see those papillae? Which surface of the tongue you see the papillae? Dorsal. Correct. Dorsal. That's why you see, then this becomes dorsal and inferior become ventral. Hence this is the dorsum of the nose, and perhaps that inside will be the ventrum of the nose. That makes sense? So this is how it is. Like if we would have a long snout like an elephant, that would be the dorsum at the front, and the back of the snout would have been, you must have seen the trunk of the elephant. Have you seen the elephant? Have you seen an elephant in your life? Yes. All right. So if you look at the trunk, the front is the dorsum, and the back, which is facing towards the mouth of the elephant, that's a ventrum. If we would have a long trunk like an elephant, this is how our nose would have been. Yes, doctor, I saw an elephant. Don't call me an elephant, okay? Now, the bony framework of the nose, it will contain nasal bones, frontal processes of maxilla, and the cartilaginous frame is formed by septal cartilage, lateral nasal cartilages, major and minor alar cartilages, which I will show you in the next slide. Okay, so we have bony framework and we have the cartilaginous framework of the external nose. Okay, now this is how it is. So if you look at the bony framework and cartilaginous framework, the bony framework is formed by the nasal bones and the frontal processes of the nasal bones. Okay, the nasal bones and these are the maxillary processes which are going towards the frontal bone, hence we call these as the frontal processes of the maxilla. Okay, now the cartilaginous part, cartilaginous framework is formed by the septal cartilage, which is sitting right in the center, and then we have these processes. Now this process of the septal cartilage is sitting laterally, hence we call it the lateral process of septal cartilage. Then we have these cartilages which are sitting on either side, we call them as LR cartilages. Okay, so we have minor LR cartilages and a major LR cartilages. Okay, these are forming the boundaries of our nostrils, and together in the midline they form the very tip of the nose. Hence the tip of the nose is not soft, it's firm. Okay, and this is how, if you look at different swellings in the body, hard will be like head, soft will be like lips, firm will be like our tip of the nose. So tip of the nose is kind of firm. So you see that this is how the external nose is formed. Now this white part which is shown here is the dense fibrous connective tissue. That's the chubby part there, and this is where usually people, not girls only, but people like girls and boys, men and women, all, they can have their commonly they have their nose pins pierced at this point. Okay, does make sense? Do you understand the external framework of the nose, how it is formed? It is formed by bony and cartilaginous parts. Okay, the bony part is fixed while the cartilaginous part is firm. All right, what would happen if we see a dry bone? And I'll show you then. Now look at these cartilages that we talked about. We saw the nasal bones, and we talked about the nasal bone yesterday. These are commonly fractured bone in a direct impact on the face, and we have these cartilages which have been named differently. Upper lateral cartilages or lower lateral cartilages are LR cartilages, major LR and minor LR cartilages, which you can see there, and this is the chubby part that I was talking to you before. Okay, now what happens if there is a fracture of the nose? You see that the way that the nose is sitting in this picture is slightly bent. So if there is a misalignment of the bone and the cartilages, the dorsum, the bridge of the nose, will be tilted to one or the other side. Now these are, you don't need to be expert on that. And can you all see different? Yeah, Mona said DNS. DNS is deviated nasal septum. Yes, but there are other causes of deviated nasal septum. Have a look at the different profiles of the nose: small, medium, and the tall, and then they have been further divided. Hero, small hero, a medium hero, a tall hero, or a soft tall, and a soft medium, and a soft. So these are all different shapes of the nose. You don't need to remember all these shapes. It's just to show you that all these nose that we see across in our daily life, we see many people nowadays, they have covered their noses, and I would expect you to cover your nose while outside in communication with people. You put the mask on. Now this is also the taxonomy of noses. Okay, now you must have seen, like, people sometime they make sketches, especially those in investigative fields like in police and other thing. Sometimes they, if you want to locate a person who is on run, so they try to make a sketch of it. All these profiles will help them to make a picture of the person. That's why we have the taxonomy of noses, so you can see Asian, black, white, Latinos. They have all different shapes of the nose, and then you can put them together along with the profile of the eyes and ears, so they can roughly come up with the shape of the face of that individual. Okay, You don't need to remember everything. I want you to, celebrate the nose. Nose is performing many functions. One of the important function is the social function. Social function of the nose is also very important, because you see it's a kind of a sign of prestige. In this lady, you can see, besides many tattoos, you see the nose plugs. Okay, nose plugs which are placed in the LR, soft part of the nasal cavity. And now you can see the different types of nose pins and nose rings that mostly women are been shown in this picture, but nevertheless you have a man with mustaches and beard having a nose pin which is passing through the septum of the nose. So it's not only passing through the soft part of the nose, external nose, but also through the septum. Not only one side but both sides. So you can see that there are different types. They are all coming from different cultures. So this is how the social function of the nose. Now if you look at the external nose, the blood supply of the external nose is coming from the third part of the maxillary artery. The third part of the maxillary artery will finally terminate as infraorbital, and that's where it will form those lateral nasal branches which are supplying the dorsum of the nose. Okay, facial artery also supplies the LR and the lower part of the septum. When the facial artery is passing along, remember we talked about the facial artery and its tortuous course. You can see it there, and that's where you can feel the pulse of the facial artery. And the facial artery is also supplying the lateral, the external nose with different branches. Now I want you to look at these branches which are supplying the upper lip. From there you will have branches which will supply the nose. Okay, that makes sense. Now the external nose obviously will have sensory innervation and the ophthalmic branch and the maxillary branch of the trigeminal. By now we all know the supratrochlear and supraorbital are the branches coming out from the ophthalmic division, while the infraorbital is the maxillary division of the trigeminal nerve, and their terminal branches are supplying the external nose. Okay, they are all sensory. Now we talked about the nasal fractures, and its nasal bone are commonly fractured in sports and car accidents. Okay, and the nose may be deformed after that, and as Mona mentioned before, DNS, which is deviated nasal septum, it will be tilted one or the other side. Okay, now if the blow is hard enough, not only fracturing the nasal bone, but it can also damage the bones from inside. Somebody was asking about the infratrochlear, from which branch? Infratrochlear comes supraorbital, supratrochlear. These are from ophthalmic, and infraorbital is from maxillary. Now nasal cavity. All right, nasal cavity. Let's look at the nasal cavity. Now if we look at the nasal cavity, the nasal septum lies in the midline and divides into two. All right, so nasal cavity is sitting inside. Now what we have done here in this skull, you see that the soft part is removed. So in a dry skull, when you look at the anterior part here, it looks all dry. So the soft part is gone. Now you only see the bony outline of the nasal cavity. Sitting right in the center, we have the nasal septum, and we will see what forms the nasal septum. Now the anterior opening, we call them as nostrils, external nostrils. The internal opening or the posterior opening of the nasal cavity are called as choanae, or the posterior nostril. If you can't remember the word choanae, the posterior nostrils are equally good. Okay, does that make sense? And I'll show you with many other pictures. So we have anterior nostrils and we have posterior nostrils. We have a nose, but we have a right and a left nasal cavity. Right and the left nasal cavities are divided by the nasal septum. Okay. Now tell me what are the functions of the nasal cavity. You need to talk to me about that. Okay. So you can unmute yourself, and if you like to talk to me. Who would like to answer some of these questions? Nasal cavity functions. Filtration, all right, okay. Humidification, correct. Now, Lean, hold on. Lean, would you like to talk to us, Lean? You can unmute yourself, Lean.
Yes, doctor.
Excellent. Thank you very much for joining us. And yeah, you mentioned about a function which was what? Filtration. How do you achieve? Yeah, sorry, you mentioned about humidification. How do you achieve this humidification?
Yeah, I'm not sure, but there is a huge blood vessel system in this nasal cavity. So what I think is that because there's a huge blood work system in this nasal cavity, there is a humidification and warming system also.
Excellent. So humidification basically comes from the secretions in our nasal cavity. And Al-Nood, are you with us? Al-Nood, and if you like to talk to us and tell us how do we achieve this warming mechanism?
Through the blood supply.
Excellent. Through the blood supply. Now you can imagine humidification and warming both are related to the blood supply. And if we increase or decrease the blood supply, these functions will be affected. Okay. Now, Bushra mentioned about olfaction. It's a very good function of the nose. Olfaction. And Bushra, can you tell us about how do we achieve the olfaction and how it is different from the general sensation?
Yes, doctor. I guess we achieve it through olfactory nerve and
olfactory nerve fibers. Yes, olfactory nerve fibers are hanging down. You must have learned about it. We must have talked about it before. So they are hanging down. These are receptors for chemical which are giving us the odor. Different types of perfumes that we wear. So yes. How is this different from the general sensation? For instance, if something which is irritating in the nasal cavity, how the olfaction is different from that?
I don't know the answer for this.
Can anyone help us to differentiate between the general sensation from the nasal cavity? For instance, if there is a boil inside and it is painful. And once again neuro.
Doctor, they are saying the chat box that it doesn't pass through the thalamus.
Sorry? Yes, olfactory nerve doesn't pass through the thalamus, yes. This sensation, that's why it's a primitive sensation. The general sensation is from trigeminal nerve. The general sensation. So trigeminal nerve through different branches will supply the nasal cavity from inside and outside for the general sensation, and you are correct in saying so. Now, sound, it adds resonance. Hence, if you look at whenever you suffer from the cold, we see that our nose gets blocked because we cannot talk like normally. Why? Because our nose is blocked. Did you hear me? Did you hear the quality of the sound? Yes, no. This is what happens when our nose is blocked. Okay, so these are different functions. Now, for passage of air, it needs to be fixed. Hence, we have bony framework, so it will keep it open all the time. Okay. Now, a bit of a developmental aspect here. So you see that we have a nasal septum. If you look at between week 7 and 8, we have nasal septum which is growing down, and this is where the tongue is So this cavity is in communication, the oral cavity and the two nasal cavities are in communication with each other. On either side we have developing maxilla, and you see that the two maxillae, right and the left, will join together with this septum. So we will have these two right and the left nasal cavities separated out from each other. Okay, now you can see the ethmoid cartilage, frontal bone, which is developing up there, and the septal cartilage, which is sitting right in the center. Okay, if we look at further, you see that the septum has come down, the two maxillary processes have joined together. So you see this area, which is the site of the fusion of the lateral palatine processes of the maxilla and the nasal septum, everything is joined together, and we have these two separated out nasal cavities and the oral cavity. If there is any abnormality, then there would be a cleft palate, oral cavity and the nasal cavities will then join with each other. Now if you look at the lateral wall, it is thrown into these folds. Now remember, we talked about ethmoid bone yesterday, and we talked about the superior and middle concha. These are the parts of ethmoid bone itself, while the inferior concus is a separate bone. Now remember this, because we will develop our story further on that. Okay, while the maxilla are sitting on either side, maxillae right and the left, they are sitting on either side. They are contributing in the wall of the nasal cavity and also the hard palate, which is forming the roof of the oral cavity and the floor of the nasal cavity. This is where you look at the development from you can see from week 6 to week 10, and you can see these processes which are coming down, and these two maxillary processes which are coming from the sides, they join together in the midline, and we have these two external nostrils and the oral cavity. This is where we see the two external nostrils and the oral cavity separated out. Hence, if you look at the upper lip has philtrum. You remember we talked about the region, and the philtrum, it's formed by the middle part is extension of this intermaxillary segment. Okay, the intermaxillary segment is forming that philtrum. So upper lip is kind of complex in its development. Hence, if there is any gap, would be the site for the cleft palate. Okay, that makes sense. Now what we saw before was the development. Now it's just a recap of the different bones which are forming the wall of the nasal aperture. You see the maxillae which are forming the aperture along with the nasal bones. They are forming the external nasal aperture. Now this bone is an important bone which is contributing in the formation of the nasal cavity. This is ethmoid. Remember we talked about crista galli and the perpendicular plate of ethmoid. This is the one which is forming the septum of the nasal cavity. Hence we have the right and the left nasal cavities on either side of it. Now this part is the cribriform plate, and this cavity would be the right and the left anterior cranial fossa, which will be up there. All right, so you see that bone, ethmoid bone, is wedged between the two orbital cavities and a nasal cavity. That makes sense. Now if you look at this part of the ethmoid bone, we have a superior and the middle concha. Superior and middle concha are the parts of ethmoid bone itself. Now within the ethmoid bones there are these pockets of spaces which we call them ethmoidal air cells, because these are filled by air. Okay, that makes sense. So on one side we will have the orbital cavity, on the other side of the ethmoid bone we will have the parts of the nasal cavity. So ethmoid bone is an important bone. The other bone which is contributing in the roof of the nasal cavity would be the sphenoid bone, and we talked about the sphenoid bone yesterday. This bone which is sitting in the midline, a single bone, is called vomer. This is the posterior view and this is the lateral view of the vomer. Now in this view you can see the perpendicular plate of the ethmoid bone. Can you all see that? Can you all see my pointer? Yes, no? So this is the ethmoid bone which is coming down from the middle. This is the vomer. These two bones along with the septum, cartilaginous part of the septum. So these three structures together will form the septum of the nose, which is dividing the right and the left nasal cavities. Okay, now you see these are two bones and this is the cartilage. If at the time of development, if they do not align nicely in the midline, the nose will deviate to one or the other side. If one or the other component grows faster and more as compared to the others, the septum will deviate to one or the other side. This will also lead to deviated nasal septum. This is a very nice line drawing which is showing us the different bones which are forming the different walls of the nasal cavity. Now this is the green is the ethmoid bone. You can see the crista galli, the cribriform plate, which is the passage for the olfactory nerve fibers. On either side we have the body of the ethmoid having these ethmoidal air cells, which are anterior, middle and posterior ethmoidal air cells. Then we have the superior and the middle, superior and middle concha, while the inferior concus is a separate bone. The inferior concus is a separate bone itself. Okay, that makes sense. In the midline, the perpendicular plate of ethmoid will join with the vomer to complete the septum along with the cartilage. Now what is forming the floor of the nasal cavity is basically our maxilla. So palatine processes of the maxilla and horizontal plates of the palatine bone, they will form the floor, while the roof is formed by the cribriform plate. Most of the part, some part will be formed by the sphenoid, and I'll show you in this picture. Okay, so if you look at the roof at different points, these are the different bones which are forming it. So if you carefully look at the line which will run now, you see that this red line, can you see that red line? Can you see the red line running from anterior to posterior forming the roof? So we have the roof formed by the frontal and nasal bones, cribriform plate of ethmoid and the body of the sphenoid. That makes sense? Now if you look at the floor, palatine process of the maxilla and horizontal plate of the palatine. What is an uncinate process? Forget about it. These are small bony points here and there. Don't be carried away with these smaller details. Okay? Hisham, do you agree with me? Yeah, just don't be carried away with these. There are many other bony points here and there. You don't need to remember everything. Okay? Now let's look at the floor. So from the front to back, we have the palatine process of maxilla and horizontal plate of the palatine bone. On the other view, you can see these same bones which are forming the floor. Now, the medial wall, we talked about the medial wall, which is formed by two bony and one cartilaginous part. Okay, so perpendicular plate of ethmoid and vomer are the bones, while septal cartilage is forming the cartilaginous part, sitting more anteriorly. Now, lateral wall. Now you see that which bone is formed. This orange bone is ethmoid. Remember we talked about ethmoid bone and these bony projections, superior concha and the middle concha, these are the bony projections. Okay, so the lateral wall, which is formed mostly by the ethmoid bone, will have a superior, middle concus. Inferior concus is a separate bone, which is this bone there, partly lacrimal bone. You can see an ethmoid and perpendicular plate of this is the perpendicular plate of the palatine bone, which is forming the lateral component of it. Okay, now these are the different regions that we talked before. That makes sense? The nasal cavity regions: olfactory region, respiratory region and a vestibule. Tell me what would be the structural differences between these three regions? Epithelial differences, beautiful. So in the olfactory region, we will have sensory epithelium, special sensory epithelium. Okay, vestibule will be like any other part of the skin, having lots of hair, which we call as vibrissae, and these are the ones which are helping us to filtrate the air. Most of it is respiratory region. Most of it is respiratory region. That's where we have pseudo-stratified columnar ciliated epithelium along with the goblet cells. Okay, now these are the external nostril, while this area there is the internal nostril or choanae or internal nares, all same thing. They would take the nasal cavity into the area of the pharynx, which we called as, which pharynx? Nasopharynx. So whatever air comes in, pass through this area and gets into the nasopharynx. Now if you look at this line drawing, that's where you see the conchae and the meatus. Now conchae, concus is a singular, concha is a singular, conchae is a plural. Meatus. Now meatus is a space underneath every concus. So we have the superior, middle and inferior concus. Underneath that we will have these spaces and we call them as meatuses. So how many meatus you expect? If we have 3 conchae, superior, middle and inferior, we have 3 meatuses. Superior, middle and inferior meatus. Superior, middle and inferior meatus. Now into these meatuses, remember that we talked about, you see these meatuses there, these meatuses there. Now these different structures are opening into these meatuses. Now what are these structures which are opening into meatuses? Different paranasal sinuses. True, there are 3 meatuses on each side, there are 3 conchae on each side. Now sphenoethmoidal recess. So where is this recess? This space there, where my pointer is now, which is sitting superior to the superior meatus and inferior to the sphenoid. That's why we call it as sphenoethmoidal recess, which is this recess there. Okay, I'll show you in the next diagrams as well. Now into sphenoethmoidal recess opens the sphenoidal sinus. In the superior meatus we have the posterior ethmoidal sinus. In the middle meatus we have the openings of the anterior and middle ethmoid sinuses or air cells. Also the frontal sinus opens in there along with the maxillary sinus. So you see these sinuses are opening into their respective meatuses. That makes sense? In inferior meatus we have the nasolacrimal duct. What is coming out through the nasolacrimal duct are the tears. We are constantly producing a tear film which is coming into our nasal cavity. That has been evaporated. But at the time when we cry, when we cry, we also blow our nose. Why do we blow our nose? There is a lot of secretion from the eyes into the nose through this nasolacrimal duct. If we block it, what will happen to the tears? They will come out from our eyes. Okay? That makes sense? I'll show it here. Now you see, constantly our tears are going into, and you will learn the lacrimal apparatus, which is carrying our tears from the lateral side to the medial angle of the eye. From the medial angle of the eye, there is a duct which is going into the nasal cavity, which call it as the nasolacrimal duct, and the tears are coming there and they are being constantly being evaporated from there. If we cry, there is overflow in the nose as well. Now let's look at this sphenoid bone there, and this is the superior concus. This space there is called as the sphenoethmoidal recess. This is the superior concus. So this space underneath that is called the superior meatus. This is the middle concus, and space underneath that is called as the middle meatus. This is the inferior concus or concha, and space below this is called as the inferior meatus. Now we have these spaces which are sitting in our bones, which are sitting on the side walls of the nasal cavity. These bones have these pockets of air, hence we call these as paranasal sinuses, paranasal air sinuses. Okay, and I'll talk to you more about these in a while. Now you see different probes. These yellow probes that you see, they are being pushed through For instance, from this frontal sinus, if you pass a probe, it is opening in the middle meatus. If you pass a probe from the maxillary sinus, it is opening in the middle meatus. Okay. Now, if you look at the middle ethmoidal cells and also the anterior ethmoidal cells, they will open in the middle meatus, while the posterior ethmoidal air cells are opening in the superior meatus. Okay, they are opening in the superior meatus. Does that make sense? So different sinuses, different air sinuses are opening in different meatuses. Now let's look at this this meatus there, which is underneath the inferior concus. Now you see at every point we have trimmed, we have removed the part of the concus so we can see the space under. You see that this cut edge margin, so we can see the underlying space and the openings. Now in this space we have the opening of the nasolacrimal duct. Can you see this nasolacrimal duct there? This is the opening of the nasolacrimal duct, which we talked before. Now the blood vessels which are supplying the nasal cavity, there are 6 vessels altogether. From the ophthalmic artery, which is the branch from the internal carotid, we have anterior and posterior ethmoidal branches. From the maxillary artery, we have the infraorbital, sphenopalatine, and greater palatine. The last branch is coming from the facial artery, which is giving off the labial, and from the labial we have the lateral nasal branch. Okay, and I'll show you in this diagram. So you see these different vessels which are coming and supplying the lateral wall of the nasal cavity, anterior and posterior ethmoidal arteries, sphenopalatine artery. Remember we talked about sphenopalatine foramen yesterday? How many of you still remember that we talked about it yesterday? Sphenopalatine foramen, and that's what I was telling you, that sphenopalatine would carry vessels into the nasal cavity. So third part of the maxillary artery, which we will learn later, continues through this foramen into the nasal cavity and will supply the lateral wall of the nasal cavity along with the septum in the midline. Okay. Now you see these branches, as if they are going forward, they will join with the branches from the facial artery. You see that the branch from the facial artery, also these branches which are coming from the greater palatine artery. So greater palatine vessels are supplying the palate, but they continue forward and will supply the floor of the nasal cavity. Now look at the network of the vessels here, and look at the network of the vessels on the septum. So this is the nasal septum. You see these different vessels. Now on the sides of the septum, this area, which is called as Kesselbach's area, this area having a lot of anastomosis. Now where is this anastomosis in terms of the thickness of the wall? This anastomosis is sitting in the submucosa. Now what happens? You remember we talked about humidification and warming and everything. What happens during summer? What happens to the quality of the air? And what can happen to the mucosa covering the nasal cavity? Hot air, yes, hot air. It becomes, the mucosa become dry. The dry air leads to the mucosa become dry. So what happens to the mucous lining itself? Cracks. Excellent. So the mucosa itself, as if there will be cracks in the mucosa. If there is a crack in the mucosa, what will happen? It will lead to this condition, which is a nosebleed. Okay? The nose started bleeding, epistaxis. Which age group nosebleeds are common? Which age group the nosebleeds will be common? Which age group? Children. Of course, children is school going, especially during summer, if they do not wear those heads with the big brim, the big brim, which is covering them completely. If they take it off, go out in the sun, start running here and there without drinking a lot of water, they can lead to this epistaxis. Now, this epistaxis which is coming from the nose, this is coming from the front. Hence we call it the anterior epistaxis. Now you can see the site of the anterior epistaxis as compared to this epistaxis, which is the posterior epistaxis. Now this posterior epistaxis, the source of which is basically the sphenopalatine artery and its anastomosis. This posterior bleeding takes place in patients with which condition where these blood vessels can rupture? Excellent. Hypertension. Blood pressure goes up. Hypertension. That's where these vessels open, and some people say it is a blessing. These vessels rupture and the loss of the blood will perhaps regulate. Would people be sniffing out the blood or spitting out the blood in case of the posterior epistaxis? Would they be sniffing out or they will be spitting out the blood? Beautiful. Most of the time they will be spitting out the blood instead of sniffing out. Like in case of anterior epistaxis, they will come from the front. Excellent. Veins, as we talked about, rich submucosal venous plexus, especially in the lower part of the septum, in the middle and inferior conchae, very prone to bleeding after infection and allergic reaction. And this is what would give us the stuffy nose. If you are allergic, loss of blood supply, venous congestion, and stuffy nose, your nose is blocked. That's what happens with people who are allergic. Okay, it's the same submucosal venous plexuses which are helping us in thermoregulation. So you see that blood is circulating a lot. It will help regulate the. Can you repeat why warmth will increase the risk of bleeding? You know why? Because the mucosa gets dry. If the mucosa gets dry, the most likely the mucosa will get cracked. These vessels which are sitting in the submucosa, they will be exposed and they can bleed. That's what happens in case of during the summer, especially in young children. Okay? Besides poking their nose. Do you watch the cartoon Simpson? If not, watch it and watch a character named Ralph Wiggum. Okay? He pokes his nose all the time and he bleeds from the nose all the time. Okay? Now, the innervation, we talked about the trigeminal nerve supplying the general sensation to the mucosa of the nasal cavity. Olfactory nerve is special, and for the mucous glands, we have the branches from the 7th cranial nerve through pterygopalatine ganglion. This is how we distribute the nerve supply. So if you draw a diagonal line, so we have these branches which are coming from the first division, which is ophthalmic division of the trigeminal. These are from the maxillary division of the trigeminal. You don't need to remember every tiny name of every nerve, but if you remember, the upper anterior part is supplied by the ophthalmic branches, and it is easy if you relate it with the region of ethmoidal. So you will see these are the ethmoidal nerves, and these would be the pterygopalatine ganglion there, and these branches will be coming from there and will supply the general sensations. Okay, same is true for the septum. So we have V1 and V2, ophthalmic and maxillary division of the trigeminal. Now the paranasal sinuses. Now we talked about the nasal cavity, which is sitting on either side of the septum. Into this nasal cavity, openings of the different paranasal sinuses. We talked about ethmoidal air cells. We briefly mentioned about the maxillary sinus. In the frontal bone, we have the frontal sinus. Now, these sinuses are present in our bones which are sitting around the nasal cavity. Okay? Except the mastoid air cells which are sitting behind our ear. They indirectly communicate, which we will learn when we learn about the ear. Why do we have these paranasal sinuses? Any thoughts on that? Why do we have these paranasal sinuses? Can someone, Sama, Sama, would you like to talk to us?
Yes, doctor.
Okay, you mentioned about, what did you say at the beginning?
I mean, it makes the head more light. Like
To make the head lighter. You know what? This could be seen as make your head lighter, as if you feel higher. Okay, how do we make it lighter? Because of the spaces?
because of the spaces, and these spaces are filled with air. So
True, yeah. Some people say it's an economical way of developing a bone. You fill it with air, so the size will still be big, but it will be much lighter. How do we know that it would be heavier if these sinuses were not there? How do we know?
because in the ships, for example, we make the bottom of the ship filled with air so that we can lighten the ship and make the ship flow on the sea.
Right. You're right. It's the basis of it's the physics. It's a physical basis of it. But in humans, in you and me, how do we know that if these sinuses are filled, they become heavier?
For example, in sinusitis.
Excellent. You see, that's what happens in sinusitis. Our face becomes slightly heavier. That's why we like to tilt our head down. We don't want to see upward because it's very painful at the front. That makes sense?
Yes.
Does that make sense to all? Now it is also maintaining pressures and regulating pressures, and it's also helping in resonance of the sound. Agreed. Now, how do we know the sound is more resonant if these pockets are present? Because when we have sinusitis, when these sinuses are filled with fluid, then our quality of the sound changes. It will become like this. Our quality of the sound changes. This is how, as if we are talking from the space. Okay? You see, this is what. Now, what happens? Exactly. This is what happens during the flu. Beautiful. The quality of the sound changes. Not only the quality of the sound changes, but the quality of the smell changes. That makes sense? The quality of the food that you taste, that also changes. So all these. Now, but interestingly, these sinuses are present in animals who do not make any sound, and they are absent in some of those animals who make sound. So you see, there are theories, different ways. The easy understandable is, this is the economical way of growing the size of our face. Okay? So what happens with the age, we will learn later. That makes sense? Now let's look at what are these sinuses. We have frontal, ethmoidal, sphenoidal, and maxillary sinuses. Function, lightening of the skull and adding resonance to the voice. And in children, they are rudimentary, very small to absent, but after puberty, the paranasal sinuses enlarge because of the eruption of teeth and everything. So what happens to the size of the face? Size of the face in case of infant, you see it's very small without any sinuses in these, but after the development of these sinuses, we elongate our face. So what happens at the older age? Remember we talked about the size of the face once again reduces because of the bones. Bones are become thinner, bone resorption, eruption, the loss of teeth, everything will reduce the size of the face. Now let's look at these sinuses there. Can you all see these sinuses? This is the frontal. These are the ethmoidal cells. This is the maxillary sinus, and this is sphenoidal sinus. Now you see that the ethmoidal sinuses are in small pockets, hence they are anterior, middle and posterior ethmoidal sinus, while the frontal sinus is one on either side. Sphenoidal sinus is usually divided into one on the right, one on the left, but it could be just one common sinus sitting in the body of the sphenoid, while the maxillary sinuses are the bigger one. You can see the sinuses on X-ray: frontal, ethmoidal, maxillary, and sphenoid sinus, and you can see the hard palate there. Does that make sense? Can you see all these? What would happen if these are filled with fluid? So you do not see any black area. These black areas are because of the air sitting inside these bones. Does that make sense? Lean, does it make sense? Abdullah, would you like to talk to us, Abdullah?
Morning, Doc.
Good morning. Does it make sense?
Yes, it does.
Yeah. Now tell me, if you look at these sinuses, which are opening in these meatuses, in different meatuses, which is the easiest of all to drain? If it is filled with fluid, which sinus is easier to drain?
I'm guessing the maxillary one.
Maxillary is sitting down there. Let me go. The maxillary is sitting down there. Okay? It has to open into the sinus. So you see that? Let's look at this one. The maxillary sinus is in the maxilla. That's where the maxilla. This is the sinus. It has to drain up there in the middle meatus. So look at the flask. This flask, which is the maxillary, and this flask, which is upside down, is that of the frontal. Which one is easy to drain? Frontal is upside down, so hence it is easy for the fluid to come down with the gravity, while the maxillary is difficult to drain. If you have a flu and if your right nostrils are blocked, when you go to bed, which side do you sleep? On the right side or on the left side? If your right nostril is blocked, why do you sleep on the left side? Why do you sleep on the left side? Lean, talk to us. Why do you sleep on the left side?
So the fluid from the right sinuses can drain.
Exactly.
Can easily.
For instance, if this is the paranasal sinus, if this is upside down like this, like frontal, easy to drain. If this is maxillary, then it is difficult to drain. So when you go to sleep, if your right nostril is blocked, go to sleep and then it comes into your nasal cavity and opens. That's why you keep changing your position when you have the flu. So one or the other nostrils will keep on opening through drainage into the different meatuses. That makes sense? This is where you can see the frontal sinus, which is opening into the middle meatus. Okay, this is the maxillary sinus, and this maxillary sinus is also opening in the middle meatus. So tell me which one is easy to drain. If there would have been a fluid there, would it be easy to go up there? Would it be easy? Answer is no. That's why it is difficult. Now look at all these ethmoidal air cells which are opening into the superior and middle meatus. Thank you, Abdullah. You see that? This is how it is easy for the frontal sinus to drain, because they are upside down, while the maxillary is difficult to drain because it is upright, and the opening, like the floor, always the drain will always be at the bottom of the floor. Okay, this is how you see if there is a fluid collection in the maxillary, it has to open up there. That's where it is difficult, as opposed to if there is a fluid in the frontal, easy for the frontal to drain in. That makes sense? Normally the constant flow of the air and the mucus inside. What is the lining of these different sinuses? What type of the epithelium is lining these sinuses? Respiratory epithelium. Excellent. So they will constantly be beating towards the opening into the superior, middle or inferior meatuses. They will constantly be beating the mucus towards that. But if there is excessive amount of the fluid, then it would be a trouble. Now what if there is a fracture of the frontal, ethmoidal and nasal bones? should the person blow the nose? If there is a fracture of the sinuses, and if you ask the person to blow the nose, what can happen? Hisham has asked $1 million question. Can the maxillary be drained in different positions? That's what you change your position. That's what, if the maxillary sinus is filled, you change the position to drain it easily. Okay? In case of fracture of these bones, you do not ask people to blow their nose. Why? Because the extra pressure will lead to the spread of infection to the cranial cavity, which can then infect the meninges. Okay? Sinusitis, we talked about it. Now, if you have any questions for me. Do you have any questions for me at the end? We have few minutes left. Yeah, pressure can make things worse, because if you blow, if there is a fracture, for instance, if there is a fracture of the frontal bone, okay, if the person blows, that fracture could have involved the cribriform plate, and the infection can then travel up in the anterior cranial fossa. Huda said, can I upload my lecture?